Disorders of endocrine control, the pituitary. Great picture of how the pituitary gland, often known as the master gland, affects different organs or hormones throughout the body. We normally talk about hormone disorders as either having hypofunction, which is the absence or impaired development of the gland, or some sort of destroying of the gland due to a lack of blood flow or inflammation or infection or autoimmune disease. Hypofunction can be just a normal decline in function that we see with aging, or it can be related to receptor defects, which prevent the binding of the hormones. In hyperfunctioning, generally what we see is excessive hormone production related usually to a tumor or some sort of hyperplasia. We generally talk about hormone disorders in three different kinds, whether we have a primary hormone disorder, which basically means that the target gland is the site of the defect. We can have a secondary disorder where the target gland is normal, but the function is altered by defective levels of the hormone. Or we can have tertiary level where the dysfunction creates pituitary and other target gland understimulation. The pituitary is a pea-sized organ that's behind the sphenoid bone. It has two lobes, an anterior lobe and a posterior lobe. The anterior lobe is the lobe that secretes the hormones that stimulate glands. And we want you to understand that diseases of the pituitary are fairly uncommon. And generally, the most common pituitary dysfunction is an adenoma, which is a cancerous growth. An adenoma, which is a tumor, and it is the most common in adults. But understand that the pituitary regulates a bunch of different hormones, most predominantly growth hormone. It also activates the thyroid stimulating hormone and acetylcholine to stimulate the adrenal cortex. And then, of course, it has a large role to play in the FSH and luteinizing hormone sexual characteristics. A pituitary adenoma creates a situation where there's hypersecretion. The most common type is generally benign. We diagnose this with an MRI scan or a CT scan. The signs and symptoms that you see with pituitary adenoma is galactorrhea or lactation without being pregnant, amenorrhea, infertility, impotence. So here are all the sexual hormones again. Blurred vision, increased intracranial pressure, which we see with the triad of headache, nausea, and vomiting. The only way to treat this is with surgery. We go into the brain, we take out the adenoma, and generally the person regains normal. The hypothalamus controls growth hormone release, and this is how it happens. Please note that diabetic children, which would be insulin-dependent diabetic children, are vulnerable to decreases in growth patterns because of this effect and because the large role that insulin plays in growth. For testing purposes, this is just for your information only. We won't have anything on the test about this. Again, a very high-level overview of the function of growth hormone. I mean, generally we think about growth hormone as important for how tall or how large you grow, but growth hormone also plays a large role in carbohydrate metabolism and fat storage, and insulin plays the largest role in this process. A growth hormone deficiency leads to a child with small stature. Know that growth hormone naturally declines with age. What we would see in terms of signs and symptoms of growth hormone deficiency would be metabolic syndrome, where we have an increase in adipose tissue, a decrease in lean body mass. You would see hyperlipidemia, decreased bone density, visceral fat increase, and insulin resistance. So basically, the signs and symptoms of non-insulin dependent diabetes. With growth hormone excess, in childhood we call it gigantism. In adulthood we call it acromegaly. The biggest difference here is related to the closure of the bone epiphysis. Hands, feet, face, and skull bones grow out of control. You get a hunchback and a lot of joint pain. You also get organ growth. Hypertension is common, and because of the free fatty acids in circulation and the alterations in glucose metabolism, insulin resistance and impaired glucose tolerance is also present. For testing purposes, we won't go over the growth hormone issues, but you will need to understand the role that the pituitary gland plays in endocrine control, particularly with relation to glucose metabolism, and the big disease process that you would need to know for the pituitary would be a pituitary adenoma.